Welcome back to my YouTube channel, The Doctor and Living with Cancer. This is officially episode number 1. Last week I introduced the channel with an introductory episode that was my attempt to try to convey what hopefully I will achieve in the long term with this series, which I plan to do ongoing for as long as there's interest or as long as I have motivation, which hopefully will be for a while. This episode I'd like to focus on the symptoms that personally I had leading up to my official diagnosis of cancer. Now, you only know you have cancer when you're officially diagnosed, and you can have blood work, CAT scans, MRIs, whatever. Generally, the way that I was taught as a medical provider is you really can't have somebody tell you officially that you have cancer or what type of cancer it is until you get a biopsy. But you definitely can have signs, symptoms, and some imaging findings on workups or blood tests that are suspicious. Now, 2 years before I was officially diagnosed with cancer, which was at the age of 43, so when I was 41, I remember my first emergency medicine job. I used to be a family medicine doctor before, but it was my first emergency medicine job out of residency, and I remember just getting a lot more headaches than I've always been a headachy guy, I've always been a headachy guy, but they were worse, and I was also very tired, which was odd because one of the perks, probably one of the only perks of this job, was for the first year of your employment, you could pick your own schedule. I'm a day guy, I picked all day shifts, all 6 to 4, day in and day out. I don't know how many shifts, I think 15 to 18 a month. That was my first job for 2 years while I was basically learning the ropes on my own outside of a training environment. So I tried a few things, dietary, I stopped drinking coffee totally, took me some time, had increasing headaches for a while, and then I started feeling a lot better. Better energy, less headaches, but it didn't last, and there was still something a little bit different, and I didn't know what it was. Side note, personal life wasn't going so great, going through a relatively new marriage, which was a little bit rocky, and I thought maybe the stress of us not getting along was another thing that was attributing to my symptoms. But they came and gone, they weren't all that debilitating. You know, life went on, I worked, etc. Fast forward, had a divorce, felt better, but about a year before my official diagnosis, which I don't know how long after my divorce that was, probably over a year, I started getting urinary symptoms. And again, your symptoms for cancer, a lot of the common ones that people complain about that I see as an emergency department doctor, not a hematologist, oncologist, but is nausea, sometimes pain. Fatigue is really common. And then there's very specific ones for specific cancers. Prostate cancer can be tricky because it can mimic urinary tract infection, inflamed or infected prostate, prostatitis, or just the good old-fashioned big prostate that all of us guys are going to get if we live long enough. Now, about a year before I was diagnosed, I started getting urinary symptoms, and my predominant one was waking up at night to pee. I used to never have to do that. I used to go to bed, time X, wake up time Y, great. And despite not drinking liquids with alcohol or with alcohol 2 or 3 hours before bed, it was still happening, and it started happening more frequently. At the beginning, once a night, then it was 2, 3, 4 times a night. It still didn't really bother me, and I thought, I must be getting a big prostate. I guess this is what it means to be 40-year-old. Kind of stupid now that I think back about it. But so, bad thing about being a doctor is you know a lot from your teaching, but you also try to self-diagnose, which if you're any docs out there, you know what I mean, don't do that. So I went on a vacation to Cabo, Mexico in November of 2016, and this is when I knew something was wrong. I was at the pool and we met some friends there and drinking some beers, and then I just was, man, I gotta pee. And then 5 minutes later, geez, I gotta pee again. Oh my God, what's the matter with me? And I thought, this is sexually transmitted infected. Scout's honor, never had a sexually transmitted infected in my life. Never had a urinary tract infection that I know, but I know the symptoms on paper. I know the symptoms of people coming in it. And I thought, well, maybe this is what it is. So, I told the girlfriend that I was dating at the time, she goes, you need to get that really checked out. I said, all right, well, when I get back from our vacation, I'll go to a urologist's office. Got there, lingered on, right? This was in November, end of November 2016. Dragged my feet for a couple of months, and then in January of 2017, mid-January, it started getting worse again. And I also noted that we hike here in January in Phoenix, and I was hiking, and I would notice that I would feel like I had to pee especially when I was going up a mountain, or anything that I would exert, jogging, running. I felt like I would have to pee, and then I was gonna pee myself. I didn't, but I had those symptoms. So finally I went on Google and I made sure they took my insurance, and I went to a urologist's office that I referred myself to. So since I had a primary care doctor, he wrote a bunch of things that he wanted me to get done. He said, let's check your PSA, and we'll do a follow-up appointment in a month or something like that. And I did that, and my PSA level was elevated at 56, I believe. Yeah, 56. So my PCP called me, I was on shift, and he said, hey, your PSA level is pretty high, and I talked to your urologist, and he wants me to put you on a 2-week course of antibiotics. For me, it was ciprofloxacin. Maybe you have a prostate infection. And they also put me on a medication that helps you pee for guys with big prostates. See, that would help. So I think it was Flomax or finasteride, one of those two. And the plan was, after 2 weeks, we'll recheck your PSA. If it's prostatitis and the infection's cleared, we expect that to be decreasing, and your symptoms should be improving if you just have a big prostate gland. We'll stop there. I hope all you cancer warriors out there are staying safe, stay well, and stay alive. Till next week, or maybe a little bit later. Bye.